Hi, my name is Lel Lebanov and I'm going to talk about marketing strategy. Until 1995, only anti-HIV treatments were nucleoside reverse transcriptase inhibitors. This mono and dual drug era was one of desperate times with high death rates and lots of complications. Many people were desperate for new options, especially drugs that would work at a different part of the HIV life cycle. So Ingrezza caused a big splash in December 1995 when it became the first protease inhibitor approved by the FDA, the first in a whole new class of antiretrovirals. In the winter of 1995-1996, the introduction of the first HIV protease inhibitors, Inveraz, Indinavir, and Ritonavir, revolutionized the medical care of persons living with HIV infection. They gave opportunity for dual nuke therapy, resulted finally in the suppression circulating HIV to undetectable levels. Unfortunately, Inviraz isn't absorbed by the body as well as other anti-HIV drugs. Early HIV protease inhibitors treatments involved many pills, sometimes more than 10 a day, and frequent dosing schedules. Saquinavir and other protease inhibitors all needed to be taken with a mind towards diet. Also, short-term side effects of inverase-based therapy as well as other protease inhibitor-based therapies are well known, with frequent gastrointestinal problems like nausea and diarrhea. These side effects often resulted in treatment discontinuation. Making matters worse, long-term toxicity or fear of toxicity emerged as we treated people longer with protease inhibitors therapies. One main area of concern was body fat changes, now called lipodystrophy. Also, elevation on blood chemicals, cholesterol and triglycerides have been in person taking all early protease inhibitors. Inverase exhibits a pronounced food effect, and patients are advised to take saquinavir with ritonavir always with a full meal, according to the product information for Inverase capsules and tablets. New clinical trials showed the ability of Inverase containing highly active antiretroviral therapy to suppress HIV and increase CD4 cell counts. Subsequently, several studies reported dramatic reduction in death rate in HIV-infected individuals. These new opportunities for Inverase is a new boosted dosage form which was approved in 2003 and consists of usage Inverase in combination with ritonavir. True value of Inverase is that it became the first HIV protease inhibitor in the market, so it revolutionized medical care of HIV-infected people. After marketing Inverase, many other HIV protease inhibitors were developed, and they made possible highly active antiretroviral therapies. This is another value of Inverase to combine it with other anti-HIV drugs, which all together show much better effects. In 2003, new dosage regime of saquinavir ritonavir at 1,100 mg twice a day was approved, and the new dosage form of saquinavir, a 500 mg film-coated tablet, was approved in 2004 in the United States and in 2005 in Europe. When used as the only protease inhibitor in a treatment, ritonavir or Inverase, either version required taking many pills a day, and neither had a punch to reduce viral loads as well as other protease inhibitors. Because of these factors, most people take Inverase with low-dose Norvir, ritonavir. This boosting, as it's called, lowers the daily number of pills from 10 to 4 and increases the amount of saquinavir that's absorbed by the body. New studies have shown that co-administration of ketoconazole at 200 and 400 mg once daily with saquinavir ritonavir at 400 and 400 milligrams twice daily resulted in increased plasma concentration for both saquinavir and ritonavir, so it's a good start point for further studies. In 1995, when the drug was released, the price in wholesale was $15.89 per day, which was $5,800 per year. Nowadays, in Serbia, price for drug in drugstores is $307 per pack, and Social Security covers all costs. Price of this drug in Taiwan is $1,350. No profit prices in February 2012 for direct purchase from Roche Basel company were $105 and reduced prices were $210. The manufacturer Hoffmann or Roche suggested in the 1995 that they were ensured that every patient in the US who could benefit from Inverase would get immediate and sustained access to the drug irrespective of their financial situation, which would go through establish the Roche HIV Therapy Assistance Program.